Hey everybody, Dr. Julie here, and today we're going to be talking about type 2 diabetes in this video. In my opinion, type 2 diabetes is one of the most poorly managed conditions in all of healthcare. You wonder why? Well, you go out there, you check all these boxes, do some lab work, and yeah, they tell you take this, take that, and it's a chemical cover-up or whatever it might be, right? But the biggest thing is they ignore the underlying root cause. And the big question is type 2 diabetes reversible? Yes, it is, and we've been doing it for over 30 years. Let me just tell you a little quick background about who I am. My name is Dr. Julie Hayek. I've been in practice for over 30 years, and I've had thousands of patients through my functional lifestyle protocols that are very highly success rates, very successful. If you follow the protocols, you're going to get the success. What you need to understand about type 2 diabetes is that we need to fix the cell. You have to look at things at a cellular level or perspective. And if the cells are damaged and broken, then you have to look at that cellular part, because the cells make up your tissues make up your organs. And if your cells are damaged, that means that they're inflamed, they're broken. Your tissues are also going to be broken and then also inflamed. And what that means is that your organs will not function properly. So in order to truly get well, you must fix the cell. In order to get well, you have to fix things at a cellular level. You have to look at the receptors. You have to look at the inflammation. You have to look at the lifestyle factors. And what we do as functional doctors and lifestyle medicine practitioners is that we dig, we find, and we fix the underlying root cause. We solve the puzzle, not just spending 5 minutes with you and say, oh, come back in a few weeks. No. We are not just trying to fix some blood work. We're trying to get people healthy. And that's really the most important thing. So we look at foods, we look at nutrients, we look at toxins, we look at bad fats, sugars, hidden sugars, and all of this shows us if there's inflammation. It helps us to understand cell health, gut health. And we have to look at things from a holistic perspective, from a global perspective. You are more than just a lab mark. We have to look at the big picture. And this is what we do. And it works so well. If you're struggling with type 2 diabetes and you want help getting this thing reversed, look at some stats. Here are the scariest things about type 2 diabetes. Did you know that there is 30 million that have type 2 diabetes? That's 1 in 10 people have full-blown type 2 diabetes. If you think you're alone, you're not alone. Type 2 diabetes is a big problem for a lot of people. It is because of the standard American diet. And that's a sad thing. And so with a full of sugar and carbs are essentially sugar in disguise. It is the fastest way to destroy your health. It's the fastest growing disease in the country. But the scariest of all is that we have 88 million people that have prediabetes. That's 1 in 3. If those who are pre-diabetics or prediabetes don't take action within 5 years, they too will be full-blown type 2 diabetes. And what are the consequences? What are the causes? What are some of the things that happen? Your eyes go bad. Your kidneys go bad. You have numbness, tingling, neuropathy. And it's a naughty condition. And it is fixable. And that's the thing. It is fixable. It is reversible. Medical doctors will say you can't fix it. Get a second opinion, because it is reversible. We've been doing it for over 30 years. So if you want some help, I'm offering a discovery call, and it's not a pushy sales call, but an opportunity to ask each other questions to determine if what we have makes sense for you. I like to use the analogy as a map. If I'm going from California, driving to New York, and I don't have a map or a blueprint, how successful do you think I'll really be to get there? I'll probably be all over the place. I'd be lost, I'd be frustrated, I'd be confused. But if I had a straight line path to do this, and do this test, avoid this. If I had a blueprint or a map to get there, that is exactly what we have for type 2 diabetes. And so I want you to be able to have this as well. I want to give it to you. But understand that one of my staff, because we have a big staff, we have a group of people here that will give you a call, and we'll get the job done. So your next step is to click the button, fill out the information, schedule your time, so then that way we can call you back and see what we have works for you. And that's the most important thing, is helping you solve this issue so we can reverse type 2 diabetes. This is Dr. Julie, and I look forward to talking to you soon.